Hey guys, in this video we are going to talk about the surgery urology. So first about the investigations. The basic investigation is X-ray KUB, which are done from lower two ribs to pubic symphysis. And it is mainly done for calculus, means renal stone, or positioning of DJ stent. Now ultrasound KUB. It is done with post-void residual urine. Post-void residual urine. Now intravenous pyelogram or urethrogram. So it is plain X-ray KUB plus intravenous dye, and this dye is mainly sodium ditrizoate at the interval of 5 minutes, 15 minutes, 30 minutes, 1 hour and 2 hours. And the minute IVP at 1 minute is mainly done for renal artery pathology. It will give less information than CT, but with less cost and less radiation. So first, the basic investigations are X-ray and USG. So X-ray we are going to done from lower two ribs to pubic symphysis, and mainly done for the calculus and positioning of DJ stent, because we can't see anything that much in X-ray. Now ultrasound is done after voiding the urine, so post void residual urine. And the third investigation is now the contrast. This too was without any contrast. Now all the investigation we are seeing is mainly based on contrast only. So first, intravenous. So we are giving dye the intravenously, and the dye is sodium dinitrozoate 1 milligram per kg. If we are doing the X-ray KUB 5, 15, 30, 1 hour, 2 hour for kidney, ureter, bladder and urethra, to see all these parts. And if we are doing it 1 minute, then it is mainly for the renal artery pathology. It will give less information than CT scan, but less cost and less radiation. Now the pyelogram, again we are going to insert the dye, but now it won't be by intravenously, it will be mainly locally. So either you can do retrograde or anterograde, both are pyelogram only. So retrograde pyelogram and anterograde pyelogram. In retrograde we are putting the dye via cystoscope to visualize mainly the urinary bladder, ureter and kidney. And in anterograde pyelogram, we are injecting the dye into the kidney by percutaneous nephrostomy tube. So PCN tube we are going to insert into the kidney and then we will inject the dye. This is anterograde, this is retrograde. Now it is done for mainly the pathology of renal pelvis tumor and renal TB. Now retrograde urethrophy, also known as ascending urethrogram. So this two pyelogram is mainly for the upper kidney pathology. I mean upper urology system pathology like of kidney, pelvis, then ureter and urinary bladder. And now all this information will be of lower part. So mainly urethra and bladder. So first retrograde urethrogram, dye via urethral orifice, and then we are going to do the X-ray. It is oblique. Indications are for urethral injury and urethral stricture. So just done for urethra is retrograde urethrogram. And we are just going to visualize the urethra only, and we are going to insert the dye via urethral orifices with no catheter, nothing. Just we are going to inject the dye into urethral orifice and take the X-ray to see mainly the urethral injury or urethral stricture. Now about the bladder part. So you can do cystogram or you can do functional study, which is micturating cystourethrogram, also known as voiding cystourethrogram. So the cystourethrogram indication any injury to bladder or diverticula of the bladder. We are going to do the cystogram, and micturating cystourethrogram is a dynamic study. So in this Foley's catheter will be inserted, and we are going to insert the dye via Foley's catheter and then remove the Foley's catheter and ask the patient to micturate and take the X-ray. So it is a dynamic study, functional study. So indicated for vasculoureteric reflex, posterior urethral valve, or you can also do the for the stricture of urethra, but yeah, the better one will be retrograde urethrogram. Now about the radioisotope renography nuclear scan. So first is DMSA, that is dimercaptosuccinic acid scan for renal structure or any scar, basically renal morphology. So dimercaptosuccinic acid scan. Now DTPA, that is diethyl triamine pentaacetate scan. It is for function, DTPA. Now MEG3. MEG3 is important because it is mainly done in the children with PUJ obstruction. So mercaptoacetyl triglycerine scan for function, and also better especially for children. When are you going to classify as a non-functioning kidney? So if any kidney has GFR less than of 10 ml per minute, or if the function is less than 10%, then we are going to classify as a non-functioning kidney. Now some scans that I haven't included, so including in this, that is CT, MRI, PET CT. So CCT is mainly done for the tumors, that is RCC or urinary bladder carcinoma, and NCCT is done for the stones. MRI is done for prostate cancer, PET CT done for bladder, testes and prostate cancer. And in prostate cancer we are also going to do bone scan to see the metastasis. To summarizing this investigation, first the basic investigation are X-ray and USG. Then all the dye related study, so contrast related. First is intravenously. Intravenously we are putting the dye, so intravenous pyelogram or urethrogram. To mainly see the in dye and CT, in both you can actually see the whole renal system, but it will give less information than CT, but less cost and less radiation. MRI mainly for the prostate and PET CT for the metastasis. So prostate, testis, bladder carcinoma, and in prostate carcinoma we are also going to do the bone scanning. Now the pyelogram for the upper part of the renal system, so mainly the kidney, ureter, urinary bladder. We are putting dye. If we are putting by retrograde, so by cystoscope, then it is retrograde. If we are putting by PCN tube, percutaneous tube, then it is anterograde pyelogram. Now the lower part. So about the lower part, it is important to remember the indication. So if it is about the bladder, then cystogram and maturating cystourethrogram, so functional. That's why in the reflex, vesico-uretary reflex, posterior urethral wall and stricture urethra, and cystogram is mainly done for the injury to the bladder and diverticula of the bladder, and retrograde urethropography is for urethral injury and urethral stricture. And the MAC3 study in children is mainly done for the pelvic uretary junction obstruction.